It was popularized before the widespread use of fluoride, yet faded, but now is drawing interest again. Is vitamin D really beneficial against dental caries? Hello again, I'm Dr. Rob, accompanied by Tami, and you're listening to the Dental Formulator's Playbook.
Vitamin D certainly gets a ton of attention, but mostly based on immunity boosting benefits, but dental caries.
Yeah, that's right. And there might be some truth to this, but it's not likely through any remineralization pathway, like it is anyway for the gold standard fluoride.
Okay, so tell.
So first, while there's many studies out there, I'd like to draw attention to two recently published studies in 2025 in the clinical oral investigations. Both of them were, as I said, published in 2025, but one was a review and another one was based on a clinical study that evaluated children. There was a questionnaire involved, and then there was also examinations. Now, these completely independent papers were done by different researchers, and the review was done in Germany, and then this clinical evaluation and questionnaires that were given to children was done in Poland. And I'm also going to talk about a third paper, just briefly. We'll just briefly mention these, but I think that they are important. And for the listeners there that are interested in actually getting to the source material, I think this is helpful. There's a 2016 paper that was published in the Journal of Dental Research by Canadian researchers, and I'm going to use that to help the discussion as well. I'm also going to use maybe a couple others, sprinkle some other papers in there, but won't draw too much attention into it.
Okay, so when did research on vitamin D for potential caries benefits start?
Yeah, that is a really great question. In order to understand the caries part and how vitamin D even came to be, we have to actually go all the way back to the 1600s whenever rickets was a problem in America and in Europe. And because that was such a problem and that needed to be figured out first. And again, for those unfamiliar with rickets, because it's not really a 21st century issue anymore,
Right.
right? Rickets is related to bony defects. This especially affects obviously children because they're growing. Unless you have rickets whenever you're young, that will just stay with you through adulthood. Once you're an adult, you don't develop rickets then. Of course, you have other issues as you naturally age, and there's going to be maybe some bone loss and things like that due to various other aspects of just the aging process. Rickets was really important for getting the attention, and this is where we actually have to thank a guy named Theobald Palm.
Okay, so rickets, what you're talking about is it's basically a bone deformation disease,
Yes,
right?
that's right. Yeah, actually, it was affecting, I think, between 60 and 80% of the children living in poverty. At
Okay.
least, again, like we said, in the 1600s. Interestingly, it was affecting mainly those in cities.
Theobald Palm.
Yeah, I didn't make that name up, and I don't know if he was good at basketball or anything, but it doesn't matter. He is Scottish, okay? And, although he's Scottish and such, he was
Mhm.
born in Ceylon. So this is back in the 1800s. Sri Lanka
Okay.
nowadays is now the familiar term, but back in the day it was Ceylon. And he was born there in Colombo. Anyway, he did earn his medical degree at the Edinburgh University School of Medicine. And after he was done with his degree, he then enrolled himself in this medical mission that was also affiliated with Edinburgh, and that meant that he was able to go travel, right? And so he spent a lot of time in Asia. And so he spent at least 10 years, for instance, in Japan, and he was at a port city there at least as late as 1875 in Niigata. Although he didn't recognize it at the time, he did make his notes as a physician and he was interested in disease and such. He noticed that the children there, all throughout the Asia, whether it was in like Indonesia, whether it was China, Japan, even India, the children there didn't really have rickets issues. So when he left Asia and returned back to England, he started working in two different towns in England. One of them was near Liverpool. He had noticed that the children still had the rickets, and and it was just blatant to him. At first he thought, well, maybe it was just Liverpool, maybe it wasn't, but going to the different northern towns, especially the mining towns in England, right along the Scotland England border. So we're talking
Mhm.
about Yorkshire and stuff, Swansea, these areas, and all, as well as in Wales. Okay, so I just mentioned, Wales. These were heavily mining towns, right? You had a lot of
Okay.
coal and everything else. And he was really perplexed. Why is this happening? Why are all these children having the rickets? And he partnered with some other physicians and such as part of this
Mhm.
medical mission, and they all got together and they said, "Well, hey, why don't we go about because we need to gather information anyway on the public. Let's go to different areas of the world." And we will report back what we see or don't see. And he was
Okay.
getting reports then from Africa, from China, from, Italy, Spain, everywhere, Turkey, even in America as well. And what he noticed is that in the areas where there was perhaps more sunlight and there was more children exposed to that sunlight, even if they were living in privation, even if they didn't have the best diet, even if they were
Hmm.
living in very unsanitary conditions, which there were, because there wasn't,
Right.
mass sewer plans, there wasn't
Hmm.
necessarily good drinking water. So tuberculosis and diseases would still be prevalent and they would affect the children, but in the sunny areas, they didn't affect
Selling,
rickets.
right?
Yeah, yeah, rickets was not one of the major issues. In fact, it was absent. And so he wrote to the British Medical Association, and it was published in their journal and said, "Hey, I think spending time outside might help." And so that ushered in, if we need to fast forward, so this is in the late 1800s, we're
Yes.
going to the 1900s, all of a sudden there was experimentation, and this is done especially in Germany where they were using UV light bulbs, UVB light bulbs in
Okay.
particular, and they were showing, shining light on children. I mean, there's interesting photographs that I've seen. Anybody can look this up, and you would have children in their undergarments, with their eye
Don't
protection
look them
on,
up. You might
all
be flagged.
all standing in a sphere, with this bulb with like emanating the radiation, the UVB radiation, because it
Right.
was found, hey, there's a molecule in our skin, ergosterol, and that
Okay.
responds to UVB and that produces vitamin D2. And so that's one way to get your vitamin D. The other way is through like animal oils, plants and animals.
Okay.
And so cod oil is actually very rich in vitamin D. And so they would actually market bottles of cod oil, and the children were instructed to take your
Ugh.
cod oil. They called it sunshine in a bottle. And
Doesn't taste that way, I'm sure.
all this, so you either had UVB radiation or you had cod oil being supplemented to the children throughout Europe and everywhere
Hmm.
else, that there was going to be an issue if rickets was going to be an issue. And all of a sudden, the incidence of rickets declined remarkably. And Merck, even everybody's very familiar with Merck,
Of
huge
course.
pharmaceutical company.
Hmm.
You used to work there, right? As a farm
I
rep, right?
did. They're excellent.
Yeah, so in 1926 or 27, they actually synthesized one of the first vitamin D that you could buy. So you didn't have to have cod oil, you didn't have to stand in front of a UV
That's good.
bulb
Yeah.
in your
Okay.
undergarments, but at least you had an eye protection on in order to get your vitamin D intake. I believe that the vitamin D was called Vigantrol, and it was marketed by Merck since the late 1920s. I think it was 1927, and it just continued on even in the 30s, 40s, 50s. You might even be able to find it today. We're not in Germany, of course, but I think
So
it's still available.
I'm guessing we're getting to the link where vitamin
Yes,
D
right. Right. Yeah, I know. It's a long, windy road, right?
it's a good way to understand how we even came to look at vitamin D for oral health.
Yes.
But now you're going to
Well,
talk about that jump.
Well, what was interesting about this is, and this is what created a lot of the interest, is because everybody was looking at the children. Remember how we talked about fluoride was only initially maybe hypothesized to have a benefit in children?
Yes, I
It
remember
wasn't
that.
until the 1950s, whenever IU had
Yeah.
done that second clinical study on the stannous fluoride toothpaste, that they said, hey, the adults can also benefit
Hmm.
from the stannous fluoride toothpaste. They just said fluoride, but the original form of fluoride in the original Crest
Right.
fluoride toothpaste was stannous fluoride.
Right.
And so that was remarkable then. It was also remarkable with the vitamin D. They were trying to look and see, well, hey, what is going on? But the point is, if you lack certain essential vitamins or minerals, you're going to be unhealthy. And so that might lead to, if you have bony defects in your skeletal structure,
Right.
that might also affect the dentition, the quality of the dentition.
Okay. Very logical. That
Yeah,
makes sense.
so they were starting to supplement. You had either cod oil, UVB, or the Bigantrol. Okay.
Okay.
Some of the people were trying to evaluate this and say, well, is there really a prophylaxis benefit of vitamin D for caries? And the drawback for this was that it overlapped with the period in between wars and then during the war where fermentable carbohydrate rations were low and sugar content was low, at least relative to post World War II economies and
Okay.
markets.
Yes.
I mean, if anybody likes to learn about the different, stories and the foods and stuff, you'll find a lot of the foods that we like today are
Mm-hmm.
going to be built on innovations that were done then. In other words, was the poor incidence or reduced incidence in caries truly related to vitamin D? I mean, obviously it was, but if somebody is now exposed to vitamin D and now their skeletal structure is stronger, their dentition is naturally stronger
Right.
because they've
Makes
now
sense.
been exposed. Plus, they don't have the exposure to the sugars, to the fermentable
Mm-hmm.
carbohydrates. It doesn't necessarily mean that vitamin D directly, if you do this every
Right.
day, is going to have an anti-caries benefit potentially. It just might be the result of having improved systemic health
Okay.
ever since, the fetus, right?
Yeah. No, that makes
Within
sense.
the pregnant mother. So I think that that's where that at. So does that make sense?
I think so. I think it's all starting to pull together. So, as we discussed, the topical application of fluorides by dentists was already done in the 1920s.
Right, that's right.
And then water fluoridation
Yep.
came about in the 1940s, and then
Yep.
fluoridated toothpaste, over the counter, at least in the stores, launched in the 1950s. So I guess that's when all of a sudden the attention was away from more vitamin D because it was going to be turned to fluoride.
Yeah, we had, there was great efficacy as shown as long as
Right.
you're using safe levels. Again, too much of a good thing is a bad thing.
Right.
Paracelsus just teaches this,
Right.
but it's the same thing here. So if children are already healthier because the mothers and even whenever they're young in the diet and they're getting supplemented with vitamin D, then maybe there's going to be a benefit. But if you take out the fluoride and all of a sudden now you're into post-war and you have ad libitum sugar intake and fermentable carbohydrate intake, will supplementing with vitamin D be sufficient? Likely not.
Okay. Okay. So I think we're getting here. So basically, you're saying since World War II, vitamin D basically can't keep up with today's readily available
That's
foods and
right.
drinks and all the great stuff
Yep.
that we have.
Yep.
Okay. But you are saying that now maybe vitamin D is making a comeback.
Yeah, and this is the issue. So in one of the 2025 reviews, the researchers there, they said we think that there's going to be a comeback. And
Okay.
this kind of echoes some sentiments that were published in nutrition reviews in 2012. The researchers said, "Hey, look, I think that there's an overall 47% reduction in dental caries in children based on all of the prior clinical reports that were published in the 1920s, 30s, and 40s."
I'm sensing a big but.
Yes, yeah, and there is. So of all of those studies,
Right.
and there was a lot of them, I think they selected maybe about 24 of them in their review. And again, this is the 2012 nutrition reviews paper. Those clinical studies really didn't have proper control and or the examiners were not blinded. So they
Okay.
knew who had been exposed to vitamin D, whether it was
Right.
UVB, Vigantrol, or cod oil,
Therefore,
you
the
know.
risk of bias
So the,
was very high.
exactly. So in order to do maybe a better, comparison now, and especially I think it's probably appropriate now, have a study where you have either the children or adults understand that they are in a fluoridated water community or not. Do they use fluoride toothpaste or not? And now we can start taking a look at this stuff. And so that was really the basis of one of the studies that was done in Poland that I mentioned, the clinical oral investigations. We'll talk about that
Hmm.
in just a minute. It just seems like if you don't have, first, we just have to say, if you don't have proper vitamin D intake anyway,
Right.
ever since you're in the womb, if you are not getting vitamin D, there's going to be some problems. Now, whenever you're a child, that's still correctable as long as you have your supplements, right? Like,
Yes.
and even your
Yes.
recommended daily intake, right? It's about 800 IUs or so,
Hmm.
well, at least if you're an adult. And I think a children greater than 12 or so, I think it's about half that if the children
Okay.
are under 6. But anyway, that's what we're talking about. And so we have to look at that from what is the mechanism then of how vitamin D might have a benefit. If we think that there is going to be a benefit, a resurgence, if you will,
Hmm.
is it really going to be related to dental caries or is there something else? And even if it is or isn't, how might vitamin D be impacting those factors that are either giving a benefit or maybe there's just not the benefit that we can see, but that begs the question then, how is vitamin D acting in the mouth?
Okay, that
So,
makes sense. So, is that what the Canadian 2016 paper
yeah, so
discussed?
in between. So there was the 2012 review that said, hey, look, there might be a 47% reduction, but there's risks of bias and there weren't adequate controls in all those previous
Right.
clinical studies, and the differences were there. So in 2016, a paper was published in the Journal of Dental Research. This was done by Canadian researchers, and this was really interesting because they already had children that had already been enrolled in what's called the Canadian Health Measure Survey, and this was between 2007 and 2009, and the children ranged between 6 and 11 years old. And what was interesting, these researchers just went back and they combed through the data and they said, okay, do we have vitamin D serum levels, A, and B, do we have data on their caries experience? And they did have both of those. And so these
Okay.
researchers said, well, maybe we can find an odds risk ratio of some kind of correlation between serum vitamin D and caries prevalence.
And what did they find?
Yeah, so, well, there seems to be a very clear association. And we're going to use the word association. They
Okay.
did too. It's not correlation, it's not causation, it's association.
Okay. Fair
Okay.
enough.
Association between caries and serum-based vitamin D. So there was a 37% odds risk for dental caries if the vitamin D levels are at least 75 nanomole per liter in vitamin D level. That's a pretty high level. I'll talk about that in a minute. The risk ratio increases to 47% if that serum vitamin D level drops down to 50 nanomole per liter.
Okay. So again, we're going to focus on the word association. There appears
Yep.
to be an association, not a causation, but an association between caries, the risk of caries, and vitamin D.
Yeah, and we have to say that because again, it could be benefits for whenever the child is developing.
Yeah,
If
that
they
makes
have
sense.
stronger teeth and if they have stronger bones, that might be attributed somewhat to the reduced caries
That
incidence.
absolutely makes sense.
However, there's also diet.
Mm-hmm.
There's also exposure to fluoride, and although they try to, account for those, and I think their modeling is pretty good, it's important to note that, that's why this is a causation. You can't know for sure because you don't have the whole history of it. You have, yeah, questionnaires and stuff, but we don't truly know. This isn't like a well-designed study from the beginning where we look at, okay, here's the supplement
Mm-hmm.
levels, and now we're gonna, measure the response,
Right. Not causation, association.
yeah,
Okay.
exactly. So we have this association. Now, somebody's like, well, I don't know what 75 nanomole per liter or 50 nanomole
I don't either. So
per liter are.
I'm going to learn.
Let's just talk about this. So if you were to get your blood taken, right, you
Mm-hmm.
get your blood drawn, get it assessed for your serum vitamin D, it would probably be communicated to you in the form of nanogram per milliliter. Okay. And the
Okay.
reference range that they typically give is between 30 and 100. And so, what does that correspond to in terms of nanomole per liter? It's between 75 and 250. Okay.
Okay.
And so, just for the record, I supplement with vitamin D3
Mm-hmm.
and I get my serum, assessed. And so, my vitamin D in my serum is about 89 nanomole per liter. And so,
Okay,
that's
so when you say supplement, you're not talking about you're not standing there in your, undergarments with eye protection with UV
no,
radiation, you're not drinking
no,
pot oil
no,
and
no.
sunshine in a bottle, right? So you're just talking
Nope.
about
Yeah, this is just
vitamin
Yep,
supplementation.
just vitamin
Okay.
D3 supplementation. And so, they rule out the fact that there could be a direct effect on vitamin D leading to increased hardness of the teeth. What are these other mechanisms? So that's why we're talking about this, right? It's like, okay, if there is even a causation,
Right.
what's behind it? Because today's researchers know that you
Mm-hmm.
can't just put vitamin D topically on the teeth and expect the teeth to be hardened,
It's more of a
okay, or
systemic
strengthened,
type thing.
right?
Okay,
Yeah.
so what they find?
So the different mechanisms, and this is discussed in the 2025 paper, are that the vitamin D has multiple roles with respect to saliva. So
Okay.
one of the roles is that it actually helps boost the antimicrobial peptides known as AMPs that are naturally found in saliva and that are all part of our immune system.
We talked about that last episode.
Yes,
Okay.
yeah, exactly. So we have cathelicidin peptide. We didn't talk about that last episode, but here we do. And so this is a peptide that's naturally found in saliva. I think LL37 is the one naturally found in humans, and it helps to fight like the viruses,
Mhm.
bacteria, molds and things like that, yeast,
Okay.
things like that. The other benefit it has is that the vitamin D actually improves salivary flow rate.
Okay.
Okay, so in addition to the amps, it also amps up the salivary flow rate.
It's starting to make sense now.
And why the salivary flow rate? Because there's a vitamin D receptor in the salivary glands.
Okay.
So once vitamin D is absorbed by the salivary glands, and again, if you take a topical vitamin D, you might get 10% absorption through the mucosa,
Hmm.
right? So that's one way. The other way is going to be through the serum and it'll back circulate, be circulated through
Systemically.
through the glands, and that's one way. The other way is that it can actually improve salivary calcium output. Okay. Now
Okay.
that might immediately run counter and somebody say, well, you just said that vitamin D can't strengthen the teeth. Exactly. The calcium that is secreted in saliva has not been shown to have an anti-caries benefit when, stimulated by the vitamin D.
That's a new one for me.
So why might that be so? Because calcium is used in the synthesis of proteins, of those salivary proteins, by the acinar cells that naturally exist in our glands. So somebody says, okay, our glands are secreting saliva. Where's that coming from? That's coming from the acinar cells that naturally exist. They need cofactors, calcium ions, to help
Hmm.
synthesize those proteins. This is very similar to the same way in which the microbes, like your streptococci species,
Hmm.
they use potassium ions, they use sodium ions, they even use some calcium ions too to help their synthesis of the glucans and the polysaccharides that they extrude and they use as either they keep it internally for storage in case there isn't any fermentable, carbohydrate available, or they secrete that in form of them building their own plaque-like home, right?
Okay.
So that is the part of the saccharide matrix. That's their home, and it sits upon the pellicle
Hmm.
layer. And so I think that that's important that we understand and that we're communicating that that is likely how
Okay.
vitamin D is responding in the oral environment. The true mechanisms of all this, though, have not been shown. So this is an area still in its infancy, but of major interest. How does vitamin D exactly impact the proteome in the oral environment?
It's all starting to tie together a lot better for me, especially since last episode we talked about the significance of the salivary proteins and
Yep.
whatnot. So, something I'm sure listeners might not appreciate because it's really just now becoming clear to me as well is that the calcium that then the vitamin D is providing then is really essential for salivary protein synthesis,
Yes,
if I'm
exactly.
understanding
Yep.
correctly. Okay,
Yep.
right. So, and then in our previous episode, we discussed just how important the influence of pellicle proteins and how they are essential in protecting weak enamel.
Yeah, exactly. Yep.
Okay. So this shows that if someone is using topical products to clean or whiten their teeth, they might also diminish then the protein protection from the tooth surface. And then perhaps their vitamin D levels should be increased accordingly to help fight that.
Exactly. That is the exact take home right there
Okay.
from that. If you're using treatments, whether the whitening treatments, plaque removal, or you just want that clean teeth and you're doing it multiple times a day, again, it's the chronic use of
Yeah.
these things that are likely going to have the damage. It might not
Mm-hmm.
be, materializing until several
Mm-hmm.
months later at your next dental appointment or whatever, but there will be a benefit or a detriment, I should say. So then you need to increase your benefit that you're already getting from your
Right.
vitamin D. If you're at an existing level, okay, we just have to
Yes.
gauge against that. So you can either adjust your treatments or adjust your vitamin D intake. And doctors will then tell you, be careful on how much vitamin D you
Yes.
take. You can get to the point where you shake and
Which is
stuff,
one of the
and
few that you could overdose
that's
on.
one of the few that you could overdose on. So it's
Correct.
not like we have, nigh infinite ability, to take as much, vitamin D that we want. So in other words, there's an interplay here, right?
It absolutely sounds like that.
Yeah.
So that's the main point that we should really get is that vitamin D must get into the blood because it
Yes.
sounds like it's a more systemic type of
Yes.
approach or mechanism.
Yes.
But it was saying because getting into the blood is then going to help the salivary flow and calcium and
Yep.
amps.
Yep.
And so that's that indirect effect then.
Yeah, and again, while you're exposed to fluoride, whether it's from water fluoridation, whether it's from a fluoridated product, there doesn't seem to be a strong anti-caries benefit from vitamin D alone then, okay?
That makes sense.
Fluoride's going to do the hard work,
Hmm.
okay? And fortunately, it's easy work, again, and dose is okay. The dose is
Yes.
used, at least here in the US. not a problem. And as long as you're not eating toothpaste with fluoride, then it's
Yeah,
not going to
don't
be a
do that.
problem, right? The other paper, the other 2025 clinical oral investigations paper, the one that was done in Poland, they kind of attest to this. So if anybody's like, well, I don't know, let's take a look at today's, environment. Okay, so they looked at 10 out of the 16 provinces in Poland. They did the questionnaires. They had an examiner look at the teeth. They didn't use x-rays, but they did a visual examination only. They looked at caries and they looked at bleeding on probing because they were smart about what vitamin D has maybe afforded in terms of benefits in the oral environment previously.
Okay,
They
so
they
what they
looked,
find?
yeah, well, I mean, and these were what, I think they studied over 2,000 children. I think it was like
But
2,019.
that's a good
They
number.
did not find a clear caries benefit. In fact, the odds ratio is about 1.04. That's essentially like 100%. There's no difference between
Okay, that
supplementation
makes
and
sense.
not. It's like a one-to-one comparison. However, whenever they assessed the bleeding on probing, they did find a significant and noticeable difference. So the odds ratio
Wow.
actually was 0.34 for those with vitamin D supplementation.
Okay, so essentially a reduction of about 67%, if I'm understanding it
Yes.
correctly, in the gingival bleeding risk when supplementing with vitamin D.
Yeah, exactly. Not only
Okay.
is this a significant difference between those that did not have the vitamin D supplementation, but this is consistent. And again, that study was done on children.
Mm-hmm.
That study is consistent with other independent reports that weren't done on children, but have been done on adults.
Okay.
Okay. And so, what did some of these other reports? We're not going to, a lot of these you can find in the Journal of Dental Research, and they've been done within the last 15 years. If anybody wants to, more detail, just reach out. I'm happy to share. But it all affected the periodontal health. For instance, vitamin D supplementation improved surgery outcomes from periodontal
Wow.
related issues relative to those without supplementation. There was reductions in tooth loss in another study where they reported a 13% reduction in tooth loss per 25 nanomole per liter of vitamin D serum levels,
That sounds pretty precise.
right? And significantly lower odds ratios for developing periodontal disease when intake was at least 20 micrograms or 800 IUs
Okay.
relative to a lower level of 10 IUs, which is about 400, right?
Hmm.
Or 10 microgram, which is 400 IUs. So that was yet in another study. So those are three independent studies that correlated pretty well with one another. And then all of a sudden we had this bleeding on probing. So,
So correct me if I'm wrong, but what I think I'm hearing and what all this seems to be pointing to then
yep,
is that vitamin D supplementation can help with your overall oral health,
that's right.
just just not necessarily directly dental caries.
Yeah, that's right. And that
Okay.
and I think that's very interesting. And I think that if anybody is going forward in this path, whether you're a researcher, whether you're a formulator, whether you're an entrepreneur with the brand,
Hmm.
it's really important to understand this. The most beneficial aspects of vitamin D should be related to the soft tissue. Let's take a look at the
You wouldn't think
gingival,
that.
yeah, the gingival
Wow.
health, right? And the pellicle. And again, why is the pellicle important? It helps prevent further demineralization,
Yes.
whether it's from erosion, whether it's from an existing incipient caries like lesion, white spot lesions, sometimes they're called. I think that that's important. And it can also boost your natural immune,
Absolutely.
boosting proteins, your
Hmm.
amps that are, responsible for the immunity. And that includes lysozyme. Separate studies showed that it improves lysozyme, it improves cathelicidin, and it improves the levels of the secretory immunoglobulin A, which is again involved in immunity.
And I think you mentioned this before, and I think it's important that this applies to both children and adults.
Yeah, I know we're hammering this home. I know we're belaboring this probably to,
Oh, but
to
that's
no
really
levels.
good.
But I think that the picture is starting to be
That supports the whole
developing
systemic.
here.
Mhm.
Exactly. It's almost like when we talked about before with the nitrates, the salivary nitrates, you eat your kale or your spinach, right? And
Right.
even some of your lettuce, some of your romaine lettuces and things, your beets and things like this. You get that nitric oxide that helps to, promote certain microbiome
Hmm.
that will help the mouth. Well, here, what we're looking at is vitamin D supplementation is the analog, right? And it's helping the proteome, the oral proteome, not
Okay.
necessarily the oral microbiome, right? So you have nitrates for the oral microbiome, you have vitamin D for the oral
Hmm.
proteome. It's a neat picture. There's some really strong connections here. And again, it just underlines why vitamin D is an essential, vitamin. And the recommended daily intake again is 800 IUs. So if you're having
For
the
adults,
800
yeah.
IUs, Yeah, that's going to do really well with your salivary, synthesizing with all these amps, with, salivary flow rate, things like this.
Yeah, and so just I'm a little slow. Just I just want to make sure I understand correctly.
No, it's
Your comment earlier, basically, the calcium that the vitamin D can help provide is needed then for the salivary proteins, and the salivary proteins and the vitamin D in itself all protect the pellicle, which in turn protects the tooth.
Yeah, and this is just one tidbit that I just want to add because I use the term cofactor. Maybe some people aren't familiar with cofactor, but in synthesis, it's very common. Metals are typically identified as cofactors. You don't need a ton of cofactors. So it's not like you need a product. Like if somebody says, okay, well, calcium is really important in the synthesis of these salivary proteins, I'm going to make sure I have a product that has a certain level of calcium in it. No, that's not how it works.
Okay,
Actually, that's an
that's a great
overabundance.
distinction.
Yeah, that's an overabundance. It's kind of like zinc supplementation, right? So
Yeah, don't
zinc,
want too much of
the
that.
reason why we take zinc is to help boost our immunity, but the zinc is also a cofactor, and that's responsible also for synthesizing certain proteins
Okay.
by our body, not necessarily in the salivary glands,
Mhm.
but that's why zinc is important systemically. That's one of the reasons.
Okay.
Here, this is a similar reason. Vitamin D helps secretes, the calcium, and the calcium is then released in just enough quantity to help
Okay.
with the synthesis of these proteins that
Thank
will
you.
then help the oral proteome.
That's a great
Yeah.
clarification. That helps a lot.
Yep. So I think that this is good, and I think that this general field is ripe for an
It
entrepreneur, for
sounds like it.
formulators to be thinking of ways to even have their own vitamin D supplement. I don't care whether they put vitamin D in a sugar-free mint,
Hmm.
to help get those recommended daily levels at least, or even have them boosted a bit because, there's a nice range that you can still be in systemically and be healthy. Or if you want to just have a vitamin, that's not just in a mint, it's just in a soft gel or drop.
Yeah.
Imagine making that part of the oral care regimen.
Yeah. So I think you just hit the nail on the head, really. Systemic vitamin D levels
Yep,
clearly impact oral health.
exactly.
And at minimum, the salivary proteins, and at the very least, gingival health, our soft tissue, right? So why hasn't this been pursued earlier?
This field is in its infancy. True understanding is still eluding many researchers, and entrepreneurs and formulators just don't know enough about it for sure. But that's an opportunity, right?
Oh,
I mean,
absolutely.
you start to figure out and you carve your own niche. So for anybody who is interested, imagine you could combine, a lot of these, combinations in, you know, for instance, like a product, maybe it has polypeptides, maybe it has stannous fluoride, maybe
Hmm.
it has these other things. Plus, on the side, you're also getting vitamin D. And you know what? To be honest with you, we already talked about how important clinical studies are in terms of
Hmm.
advertising or any kind of study. You
Or
know,
support of any data,
yeah,
right?
exactly. But clinical studies in particular for gingiva are really simple to do with the bleeding on probing. And so you can imagine a very easy, I say easy in quotes, right? I
Right.
mean, you still have to conduct the work, but it's not a challenge. It's not like we're measuring the exact proteins. That's not what we're calling for. Have two cohorts, one with vitamin D supplementation, one without,
Hmm.
and hopefully the one with some supplementation, if you're a manufacturer, researcher, that's your special supplement now. That's
Yes.
your brand,
Yes.
and then measure the bleeding on probing of either
Hmm.
children or adults because now we're seeing that it can go from children and adults, the
Right.
benefits, and then measure your outcomes at 6 months, maybe, actually 6 months is quite long. I'd say no more than 3 months. And you can get interim measurements even at 1 week and even 6 weeks.
Okay.
That's very familiar for a dental examiner if they're going to be measuring
Yep.
those outcomes.
That
And the
makes sense.
gingival aspect of it really goes well because if you know you're having a gingival benefit, if you're not having a lot of bleeding on probing, statistically with the supplementation of vitamin D, that you're boosting your oral proteome.
I mean, that's amazing. That's awesome. So overall, vitamin D for direct caries protection, not so much maybe, but especially if you have fluoride already incorporated, that it's not going to offer that direct caries
Yeah, I
then.
don't think it's going to have a direct caries benefit. That's right, based on the data that we've seen. However, vitamin D for gingival and perio-based,
Yes.
oral health, definitely a benefit.
So definitely helped with those salivary proteins, which
Yep.
helps boost the pellicle, which helps protect the tooth.
Exactly. It
Perfect.
boosts the
Okay.
proteome, just like you can have nitrates that boost the microbiome.
Yep.
vitamin D for the oral proteome.
Okay. That makes it very easy.
You're going to have opportunities to either address individuals, whatever your consumer is, or, if you're a researcher, the person that you're studying, right? The volunteer or patient or whoever participant, sometimes they're
Mm-hmm.
called because it depends on where you're at and if they're paid or not.
Yes.
But you can start to imagine different products tailored for certain ailments. So, although we did talk about, not necessarily having a dental caries benefit, what about an anti-erosion benefit? If
Okay.
the proteome is especially adept at helping to reduce erosive damage, then you could theoretically have a product that has stannous fluoride, for instance, because we just talked about that in the prior episode. Combine stannous fluoride, with maybe some polypeptides, accompany the vitamin D on the side, and then all of a sudden you're starting to put together an anti-erosion regimen for a given person, for the given consumer.
Yes.
And honestly, erosion is so big. I mean, I know that caries gets all the attention, but the prevalence of dental erosion is so high. Some reports say it's as high as caries, some don't, obviously.
Mm-hmm.
Depends on which marketing and which,
Mm-hmm.
assessment
Right.
that you're looking at. But dental erosion is a problem. We mentioned in the prior episode, even
Yes.
the ADA has a specific seal for erosion based
Mm-hmm.
stuff. And obviously that's out of the purview of the FDA. But the fact that the ADA even recognizes it
Right.
just shows you how the field is advancing,
Mm-hmm.
understanding some of these different conditions, and we're now sharing how that might be addressed, using something that's very natural and that's been going all the way back since the 1600s minimally, whenever they
Right.
identified rickets as a problem.
I think it's really worth mentioning and a great point about dental erosion. While you even said in the last episode that it's not technically a disease state, it still affects a lot of people. And
Yes,
even as we age,
absolutely.
it's going to become a problem, right? As
Yeah,
the longer you
absolutely.
live, the more likely it's to become a problem. So I would imagine that a combination of stannous fluoride, because that
Hmm.
helps best with dental erosion,
Yep.
polypeptides plus maybe a vitamin D supplementation, 100 I use for adults, for example, that might all combine to make a really healthy mouth.
Yeah, and if the polypeptide can be especially effective, water soluble, and be compatible with other ingredients, you might not even need stannous fluoride, right?
Ooh, sounds like a challenge.
Yeah, but with that, all right, we've done enough talking about vitamin D. It's probably too much talking about it, but hopefully there's some really nice tidbits that were gleaned from this. So I really hope that the importance and, one of the main take-home messages here in this episode is that vitamin D impacts the oral proteome. That's the most important part.
Yes,
And vitamin D supplementation then should be one of the ways that manufacturers, researchers try to maybe get that holistic approach of,
yes.
hey, the systemic health can impact your oral health as well. It's, circular, right? I mean, it's all encompassing. All right. And with that comment, we leave you. I'm Dr. Rob alongside Tami. We thank you for listening to Dental Formulator's Playbook. Stay curious and keep smiling.